women healthcare and leadership, but not just that. It's also with innovation. And M42 is the platform of UAE and global innovation. Then let me start with you, Sheikha Dr. Noura. As the president of Emirate Medical Association, can you tell us more about the vision of Emirate Medical Association? What's the country vision on women healthcare leadership?
Thank you so much, Dr. Fatma. Good morning, everyone. Let me start with that being an Emirati, being a doctor, being part of this community, I'm really grateful and honored to be in this country where our leadership established a policy, national policy for the women empowerment, Emirati women empowerment. Therefore, we find leaders, decision makers in all sectors, like federal government, private sectors, by all means. For example, doctors, ministers, ambassadors, and scientists. As a medical field and as being the board and the president of the Emirates Medical Association, collectively we address the challenges and the necessity how to empower our female doctors and young doctors also. Because of the necessity of developing and commitment with the vision of UAE, we are trying to overcome the challenges. So, for example, we are pairing senior consultants with the young doctors, residents, and medical students to have like sessions to identify what are the problems are facing in order to ease their pathway till they pursue their degree. And talking about, as an ophthalmologist too, allow me to also switch the gears.
As the president of the Ophthalmology Society.
Yes, so we've been involved in empowering our young residents, female residents, by initiating Young Ophthalmologist Club. I have participated in women leadership in ophthalmology, such as in Sultanate of Oman, Egypt, Alexandria also, Cairo and Alexandria. And next week in our conference, we have a session, the Women Visionaries in Eye Care System. So this is a part of how we can empower our leaders in ophthalmologists and even in medical fields. Having said that, women, it's not like gender equity. It's not a goal or a role to fulfill it. It's like a pathway to have a sustainable and excellence in advancing the healthcare also. So proudly, I have identified, or we identified, and we can feel it also, that the woman now has stepped forward with confidence to prove herself that she is up to it and confident in her role.
Yeah. Sheikha Dr. Noura, thank you so much for sharing that with us. We can feel your passion. And then, in fact, a question came to my mind. Who is behind Sheikha Dr. Noura? How you become the president and the leader in healthcare that you are?
It's a collective. The encouragement of our leadership. The government supports us, not only as a female. Any student has been supported by our government. My family is my backbone, supported me by all means, and saying that being a medical student, being a doctor, it was my childhood dream. So, and you know, it's like a collective from my parents. I took the personalities from both, so I can say it's an outcome of two great personalities in my life.
Then thank you to you and thank you to them. Thank you so much, Sheikha Dr. Noura. Sheikha Dr. Alia, can you tell us more about women in healthcare leadership? I know that women in general and women in leadership is one of your passions. Okay. And as a president of the Society of Obstetric and Gynecology, you work from two, in fact, let's say, angles, from the leadership, but also how you serve the women. So can you tell us more?
Assalamu alaikum wa rahmatullahi wa barakatuh. I would like to start by that I'm very honored to be here with great people and great mind and great colleagues. As General Secretary of the Emirates Medical Association and President of the Obstetrics and Gynecology Society and the first Emirati aesthetic gynecologist in the field. The challenges that we face as female, as women, I think is pretty much the same regardless which profession you are in or which specialty, because although the different fields may be, you are still the same woman with the same responsibilities. The shared or the most common challenge remains the work-life balance. And although men may also face this slightly, it is much greater with women. And as Dr. Noura said, we don't aim for equality, because that would not be fair for the woman in the way she is, the way she thinks, and the way she makes her way to success. Another challenge would be in the male-dominant specialities. Now, as a doctor, I always say that shouldn't apply in healthcare, because the more women the specialty is, the more demanding it is from you as a female doctor in that field. But it may still be there as some may be, let me say, it may be more male dominant. Another challenge that many female or women doctors may face is the challenge of asking for what they want. They're always shy, they're always humble. And I mean, there's a fact. Men get things done even in the majlis, or over coffee or whatever. So as a healthcare profession, you are the treasure, and you are the investment. Wherever you go, it is you that add to the place or to the specialty. So don't be humble in what makes it worth those night calls, those night shifts, you being away from your home or your other responsibilities. That all comes with a price, and you should not be humble when it comes to what would satisfy you, because if you are satisfied and you are happy, as the nature of a woman, you will always give more. That is for sure. And my advice for women in the field is always educate yourself in the managerial side. We direct and we manage from where we are and from our homes. But we tend to forget that part when we are in our professional seat. Now, you are a leader wherever you are. It's not the position that really states that, because you still need to manage your clinic, and you see more of that even in the private sector. I've worked in both public and private sector, and unless you understand the admin and management language, you will never be able to speak the same dialect, let me say. And so, I mean, the path to success and education is endless. And as a doctor, you're always the student of healthcare. But as our nature, where there's a goal, we always find a way to it.
Thank you so much, Sheikha Dr. Alia, for sharing also and mentoring all our younger generation here. I think transfer of knowledge is one of our mission, all of us. Then I want to ask you the same question as Sheikha Dr. Noura. Who is behind Sheikha Dr. Alia? How you become Sheikha Dr. Alia, the leader that we know?
Actually, many people play a role in that in different stages of my life. Being a doctor was a dream since my childhood. My mother and father, of course, are always my role models in the values that I see we grow up to be. Maybe when in a younger age it doesn't show much, but it does really come out when we are alone and away, far from them, and representing those values, because this is what the people dealing with us touch in us and actually feel, walk out feeling. At a second stage of my life, of course, the father of my children has played a big role in supporting me proceed and attain my postgraduate degrees, masters in healthcare management. And from after that period, my children have always been my support. I mean, as a mother, I've always felt that guilt that I'm not giving them enough time. But they've always been there to share my achievements. They've always been there when I was awarded the many awards. And I think if they haven't understood that and comforted me by simply being there and being proud of my achievements and actually talking about those achievements to their friends and to other members of the family, I would have always had the guilt maybe million. So that was very comforting. And I mean, they've grown now, so also my support network is definitely a big support. And I mean, look around. We're all women here. And look at the audience, presence of the men here. It means they are interested to hear what we share and what we do is definitely a support that we can't miss.
Thank you so much, Sheikha Dr. Alia, and thank you for everyone who is supporting any woman who is working on the leadership as well. Thanks a lot. Thanks to husbands and kids. That's an important point as well. We forget them sometimes. Thank you so much. Safeya Al Mqtri, you are one of the leaders of M42. We are extremely happy and proud to work with you. You are the CEO of Mubadala Health Dubai and North Emirates. Then I would like to ask you a question about, is there a strategies when you want, in fact, to implement a strategy for having more women in leadership, to optimize having these women in leadership? What are the strategies that you are following?
Assalamu alaikum. First of all, thank you so much, Dr. Fatma.
You're welcome.
And I'm honored to be invited to this panel again and again every year, and to be joining really inspirational female leaders and colleagues. I think the strategies, I'll take M42 as a case study, because I do believe that M42 has implemented it. I'm not sure if it was intentional, but it was part of the DNA, and we've seen the outcome of it with the recent launch of M42's global patient care platforms with all CEOs female leaders, which
Can I
tells
have
you a
an
lot.
applause, please? That's fantastic. It's 100%.
So this is a representation of many things. If we're talking strategies and active, work towards developing women leadership, there is an environment that was created. There is an environment that supported and nurtured women's growth into leadership positions, supported women specifically in healthcare who might be physicians by background or nurses or scientists to take on more responsibilities or to develop other capabilities, financial acumen, leadership skill sets that are required in order to take on further steps in their careers towards becoming female leaders, taking on bigger responsibilities. I think the creation of this environment is a crucial component to allow female leaders to grow into these roles. Personally, I think as well, what helped me personally was on the mentorship side, coaching was a very important component of my journey into leadership. So I echo what my fellow panelists mentioned around learning more about the managerial roles, taking on courses. So leadership education and training is also an essential component of that strategy. Visibility. So I think every single manager, first of all, we had an issue for a long time. I've noticed it where people are promoted into managerial roles, female and male. So it's both genders where they don't know what it means to manage teams or to manage people. What does it mean to develop the next members of your teams? So I think this is a general rule and a strategy that needs to be instilled across the board for new managers, for those who are growing from managerial to directorship roles to CEO roles. And even in my current role, I notice differences in what is expected from me as a new post. It's different from 2 years ago. So it's not far away, but the scope and what is expected from a skill set, soft skills, communication, being able to have compassion for the team. When are you strict? When are you decisive? And when are you embracing the team? So all of these are strategies that need to be instilled in developing female leaderships. And I also echo what the doctor mentioned around, I'm not a big believer of equality. We're different, and each, like male and female, they all have their powers and their strengths and their circumstances. So if a woman is a mother, there's no way she'll be equal to a man who doesn't have this responsibility. So perhaps the future is should be more directed towards policies, flexible systems, and working environment that enables women to deliver and to give more in the workplace and in her home. So if she chooses to be supportive of her family, there are creative ways to install, for example, part-time jobs for female, flexible working hours that enables them to be part of their family's lives and not feel the guilt, but also support her ambitions to become, to develop further as a leader or as a scientist or as a nurse. Because I believe leadership is not just, a chief title. Everyone is a leader in their position and how they approach their work and their family. So yeah, I think these summarize what.
Thank you so much, Safeya. That's very interesting, in fact, to think about women in leaders, how they tackle the problems and the needs and customize, in fact, any job or position for women. And that's why having women in leadership is so essential for all of us. Thank you for sharing your vision. That's fantastic. Thank you. Mariam Al Dhaheri, welcome on board, and thank you so much for being with us today.
Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you, Dr. Fatma. It's my pleasure to be here today.
It's a pleasure to have you on board. Procurement and supply chain. I would like to tackle with you what's the role of women leaders in supply chain. It's a different area when we look to it, in fact, especially from a leadership point of view, innovation that we are having on it. Can you tell us more, please?
I think, Dr. Fatma, generally speaking, women bring a unique perspective to each and every sector. And I think having roles where women can express empathy and coming up with a collaborative approach whenever challenged makes these systems makes these systems patient-centric systems. I think that empathy adds to the overall quality of services that we provide in healthcare. The other quite important aspect is when you think about the pandemic time during COVID, I think women were able to prove themselves in areas that are unique in nature, especially having the chance to work from different places around the world, at home, remote working, which I think enabled women to shine in these sectors because of that flexibility or because of that ability. The other quite important thing, Dr. Fatma, I think being in a time where technology is available, being in a time where data is available, have made our life way easier and made us enabled us to be able to conduct our day-to-day work while including others in the decision making. Because when you have data and you are able to analyze this data and you are able to discuss it with others, regardless of genders, male or female, that always results in a better decision making mechanism. So that's it in my opinion.
This is fantastic. Thank you for sharing with us. But again, Mariam Al Dhaheri, who is behind Mariam Al Dhaheri? How Mariam Al Dhaheri become the leader that we know within M42?
My grandmother definitely. I think
الله يرحمها.
الله يرحمها ويغفر لها. I think Dr. Fatma, being around strong women, regardless of your gender, whether you're male or female, brings the best qualities out of any person. Having, being surrounded by families that hold you up to certain values, just like Dr. Sheikha Alia mentioned, being raised with high values, high standards, being taught what is right and wrong, and being encouraged to always do the right thing, regardless of the circumstances, have taught us, at least as Emiratis, to always aim to become a better person, regardless of the field. I think, let alone being a leader in healthcare systems or being leader in any field, I think women plays incredible role in being leaders at their home by raising a generation that is going to lead the future. I think that's quite important. The other thing is, it's quite also important to recognize that we've got a fantastic leadership who have always believed in women. I think even before education systems, our grandmothers used to conduct fundamental roles in the Emirate of Abu Dhabi, Dubai, Sharjah, regardless. There are examples of Emirati women. There is this woman who have protected Al Mqtri bridge and was there as Al Mqtri bridge guard. People usually forget these historic stories, but I think in each and every community within the different Emirates, there have always been a woman behind that success. Following that, I think with the great education system, with being able to go abroad and study different specialities, mingling with other cultures, that also helped in developing and shaping the Emirati woman personality. So I think it is a collective of different aspects, but definitely it starts from home, and each and every woman here have that responsibility to plant that seed and see it to grow within time.
Thank you so much for sharing. Allah yarhamha, inshallah. Welcome on board, Dr. Mai Aljaber. Thank you. Thank you for being with us. I would like to continue with the talk of our colleague Mariam Al Dhaheri and ask Dr. Mai Aljaber how she became Dr. Mai Aljaber, who is behind Dr. Mai Aljaber, the successful physician, medical director, CEO of ICLDC and outpatient clinics.
Thank you, Dr. Fatma. Assalamu alaikum. Good morning, all. First of all, I'm honored to be in this panel with esteemed Emirati female leaders. Back to your question, Dr. Fatma, I think similar to my, I would say, sisters, definitely my family played a major role, and plus my ambition. And as an Emirati female, who hasn't Sheikha Fatma bint Mubarak, Mother of Nation, as a role model? Her support to Emirati women been a key for the success, I think, of all Emirati women and plus non-Emirati women. So that is in a nutshell.
Thank you so much for sharing with us, Dr. Mai Aljaber. Then coming to your actual position as a CEO of outpatient clinic, if we speak about innovation in healthcare, okay, what's the role you are playing in implementing innovation, especially in diabetes care with Imperial College London of Diabetes?
Okay, so definitely working in a specialized. Okay. So I think working in a specialized outpatient healthcare facility has its unique challenges, especially when it comes to a field like diabetes. And here, how we can overcome the challenges. We need to navigate the challenges with a blend of innovation, adaptability, and to focus on patient-centered cares across all interactions. At ICLDC, I think what we're doing is we're adopting a dynamic strategy and a culture that embrace a forward-thinking approach to integrate and adopt technology, and other approach to overcome the challenges that is somehow unique as well to the outpatient practices is the patient engagement. And we were successful in creating what is called the Patient Family Advisory Council, where the patient themselves are the chair of the councils. We sit as a member, we listen, we hear to their suggestions and opinion, and we action it whenever it's possible. As well, we are trying to balance between the specialized diabetes care and the overall need of the patients. And this is offered by the multidisciplinary team, where the physicians work closely with the educators, with the dietitian, with the psychologist or the psychiatrist to ensure a comprehensive care is delivered to the patient. As well, what we're trying to do is to ensure the work-life balance, which is very important, especially for male and more to when it comes to female employee, as working in an outpatient can be somehow of burning, can lead to burnout, and we're trying to balance this through different initiatives. I think with the, just for the sake of the time, this is some approach that myself dealing with in the outpatient practice, and to ensure that ICLDC remain at the forefront of providing exceptional care.
It's fantastic. Thank you for all the work you are doing. Thank you, Dr. Mai.
Thank you.
Safeya, within Mubadala Health Dubai and also the new hospital in North Emirates, can you tell us, in fact, as a healthcare woman and leader, how are you implementing innovation? How are you tackling innovation?
I think it's important to remember and reflect that we are privileged here in the United Arab Emirates as a pioneering nation, or a nation that's pioneering in innovation and taking steps forward in the healthcare innovation and technology world. We're also privileged because we're having discussions about women leadership and not, women education and pushing women. So this is something to be humble about, and really remember that we are in a blessed situation. I personally feel blessed that I am created in this, in this time, in this place where I have the opportunities that I have. And specifically in the UAE, with the recent, in the past few years, the UAE has been pioneering in investments in artificial intelligence, in genomics. We are taking first steps in the international world in advancing these technologies, in advancing life sciences, and creating the UAE as, or establishing the UAE as a hub for life sciences. So this is truly an opportunity for all, male and female, women and men, to take part in that journey. So in terms of how we are tackling that within M42, it is how we structure ourselves, the flexibility and agility in creating the platforms, the recent change that we've done or we've implemented at M42 that enabled us to create focus. You have global patient care platform, you have health technology, you have digital health, you have omics team, all centered around a shared four common or four clear strategies, and all working together towards a goal. So we were having a nice dinner yesterday with my colleagues, and we talked about what is the implementation of digital health, or what is the implementation of innovation, and it is pulling people together. It is pulling the people on the ground who are working with the patients to truly pull what is the latest, or what is the needs of the patients, in order to implement that into your innovation strategies. It's not the other way around. There are labs, there are, of course, West Coast, there are lots of labs that are creating or being creative in their innovation and technologies. But at the end of the day, you need the people on the ground to tell you what is required. For example, in Mubadala Health Dubai, we launched or piloted the microbiome test through the collaboration with our gastroenterologist, physician, dietitian team. They all work together in improving and evolving that test that allowed us to be the first in the country to launch it. Of course, developed by our colleagues in the omics lab, M42 lab. So things like that, fostering collaboration, creating these workshops where multiple stakeholders provide input and opening the door for everyone to give these ideas is the way to foster innovation.
This is fantastic, and there is only great things coming, and the future is here. Thank you so much. Any question? Take the opportunity, you have great leaders. If there is no question, I'm having a lot more. Please. Dimitri, your team is having a lot of women in leadership, yes?
That's correct. That's correct. Maybe, hi all. Maybe make a comment. I would like to say the last 7 months, I was privileged to be invited by Hassan to be part of this team. I'm really thrilled with the quality of female leadership in the country, and I'm great to see that they're taking a very stronger position after the new restructuring, and I'm certain we can see the results. Not only they deliver on the performance, but they deliver in what me counts more, in developing truly high-performing teams, inspiring people, and taking the business forward. Again, if I was to say something, I would like to say thank you very much for everything you are doing, and I feel very proud sitting here and listening your stories and how you developed so far. So thank you very much. And thank you for the question, Dr. Fatma.
Thank you so much for having all these leaders within M42. I would like to come back here to two leaders from Emirate Medical Association. Both of them, invite them on the stage and ask them, what's the vision of Emirate Medical Association on innovation? How is the innovation within Emirate Medical Association? You have 49 societies with 3 who are coming on board, yeah?
Yes.
I have a good memory,
Yes.
that's fine.
Excellent memory.
But then how is innovation promoted? And we cannot, in fact, avoid to ask this great question, especially when you are an M42 stand. Okay. Dr. Noura.
Innovation is the driving force for everything, and in medicine is to advance the healthcare system. So Emirate Medical Association, as you mentioned, that we have 49 societies. Each society has its own way to innovate. Innovation comes with diagnosis. Innovation comes through investigation, treatment, and also technologies and research database. So as has been mentioned, that innovation through the artificial intelligence, we have indeed in certain societies that they are collecting data through the artificial intelligence, doing the screening programs, and also regarding the, for instance, for the colorectal surgery, they are doing robotic surgery. This is another innovation. So we are tackling on the go what are the innovation, because the medicine is evolving every now and then. So we have to be updated. So this is our vision, to update the medical industry in UAE. And therefore, as you mentioned, the 3 societies, because it's with the vision of UAE, it has been established the Life Medicine Society. And
Congratulations.
Thank you.
Thank you so much, Sheikha Dr. Noura. Sheikha Dr. Alia, the women in healthcare leadership and innovation, what's the future? Tell us more.
Women in healthcare, innovation, leadership. I think to build on what Dr. Noura just mentioned, that translates at the level of each society. And in each society, we have both men and women. Now, as being on the board, we look into how can we actually encourage members in the societies, listen to them, to what they say, what they want, and what they propose, and actually agree with steps of agility in embracing and fostering that and supporting them from the board level. We would love to see that across the different specialties and societies, but some may be already there, faster than others, that we would like to consider them champions for others and the reference for others to learn from them. We don't need to reinvent the wheel. Innovation comes in different ways and in many levels. It's by changing a different technique taking consideration the well-being of the patient, that would definitely stimulate different thoughts, different techniques, and different experiences that might simply be accessible by seeking where it is best provided and making it available and accessible to all in the women of UAE and in UAE.
Thank you so much, Sheikha Dr. Alia. At the end, I would like to thank all of you, and I want a big applause from all of you to these fantastic leaders. I was honored to have you all on board. Thank you, Dr. Alia. Thank you so much.